Good morning, everyone, and thank you so much for joining this webinar. My name is Dr. Anireto. I'm a consultant family physician. I'm also a Beacon certified captive behavioral therapist. So in today's webinar, I'd like to talk a lot about stress management, what stress is and how we can manage it. The objectives of today's webinar is basically for everyone to understand what stress is and then basically learn our different individual techniques that can be used to manage it. What is stress? We use that word loosely. We talk about being stressed. We talk about undergoing so much stress. What exactly does that mean? Stress is a perceived substantial imbalance between demand and response capability under conditions in which failure to meet these demands has important perceived consequences. What this means is when we feel as though the demands placed on us are expectations of ourselves and the expectations other people have of us, and we feel like our ability to meet these demands is not proportionate to demand itself. So we feel like we cannot meet up to these demands. That feeling is stress. And not only that feeling of not being able to meet up with our demands, but also that the failure to meet these demands has catastrophic consequences. So stress is a perception and it can be acute or chronic. What this means is that two people can be in the same environment and one perceives it as stressful while the other doesn't. So what causes stress? So a lot of us already know this. From our future, worries about our future, worries about our career, family, health, love, home, bills, saving, so many things. But I want to draw your attention to the fact that things that cause stress can be both extrinsic, coming from outside us, work related, home and family, health and finances, and so many things. And they can also be intrinsic, coming from within. A lot of us don't realize that sometimes our own personality, the way we think, the expectations we have of ourselves, the way we approach problems, and people see problems as threats. I'm talking about personality and cognitive style. So those things place more stress on us than the environment itself does, or whatever situation it is might place on us. Other intrinsic causes of stress are unhelpful core beliefs. A core belief is the basic way we see ourselves, the basic way we, look at ourselves as individuals and interpret the world around us. So we can have of say, I am vulnerable, I am not good enough, I am helpless, or I am weak, or some positive core beliefs of no matter what happens, I can cope. I'm strong, I'm independent. So the core beliefs we have shape our perspective and drive our behavior, regardless of the external situation. Another intrinsic factor that affects the level of stress we feel is something called locus of control. So, locus of control means the feeling we have that we are either on top of our situation or not. So when we have an internal locus of control, it means that we feel like we are able or we're in control of our situation. When our locus of control is external, it means that we feel like other things besides us, fate, destiny, spiritual forces control our experiences and the things that happen to us. So I was talking about intrinsic factors, that is things within ourselves that contribute to the level of stress that we feel. So I mentioned personality or cognitive style. I talked about unhelpful core beliefs, negative core beliefs, that is the things we believe about ourselves and about the world. So if we see ourselves as vulnerable, then situations that may otherwise not be stressful will be perceived as stressful by us. And I talked about external versus internal locus of control. So an external locus of control means when you feel like things beyond you are responsible for what is going on in your life. You don't feel like you're in control of what is going on. That in itself can make you feel or perceive more stress, feel as though expectations and your ability to meet them is beyond your capability, and that is disastrous for you. Unhelpful coping strategies like people using substances can compound the stress we feel because substances, for example, have their own side effects and complications to our health. coping strategies like unhelpful behaviors, for instance, when we increase maybe bond with people that are not necessarily helpful us, people that are besides or outside our relationship, our primary relationship, these things are intrinsic and compound the stress we feel.
So we are currently changing
Are the things that we can perceive physically and cognitively that show us that we are stressed. So physically, a ton of things. Poor sleep, for example. When we are stressed, we are worried, we are less likely to get a good night's sleep. And the thing about sleep is that the worse your sleep is, the worse you are the next day, the more irritable you are, the lower your frustration threshold. So poor sleep is a consequence of stress and can actually worsen the amount of stress you feel. So it's like a cycle, a vicious cycle. Reduced appetite is another physical symptom of stress. Diarrhea or even constipation, aggravation of pre-existing medical conditions. So you might have hypertension, for example, and it's well controlled on medications. But feeling of stressed and not being able to manage it can actually increase your blood pressure, increase the pressure of your blood to the point where maybe the medications you're already using to handle your blood pressure are no longer effective. So these things are the things we see in clinic, in medical consultations, even sometimes in psychology. Pain, for example, is also worsened by stress. So how does stress, which is something I described as a perception, how does it actually worsen our physical condition? It is because stress, chronic stress, long-term stress triggers the release of hormones, cortisol, for example. So cortisol is a stress hormone. Acutely, in the short term, it helps us to meet up to the challenges we face. So God gave us these hormones to help. But when hormones stay longer than they are needed for a long time, typically more than 3 months, this helpful hormone begins to destroy the body that it was created to help. So we see cortisol increasing blood pressure, increasing blood sugar, reducing the length of time our wounds take to heal, worsening the GI motility, either increasing motility and causing diarrhea or slowing it down and causing constipation, which by itself can also affect the gut microbiota. That is the organisms that live within our colons that help us to stay healthy. And actually, we now know from research that these organisms within can actually affect our mood. So, and all because of stress. Stress can also, I've been talking about the symptoms of stress and the fact that stress has physical, cognitive, and affective symptoms. So, in terms of physical symptoms, I was explaining that the way stress causes these symptoms is by increasing or triggering the release of certain hormones, talked about cortisol, and also adrenaline and activation of our sympathetic nervous system. So, these things are responsible for the physical symptoms I explained, like poor sleep, the reduced appetite, diarrhea, and aggravation of pre-existing medical conditions. Stress can also affect us in the way we think and the way we feel. So stress can reduce our ability to concentrate, increase forgetfulness, cause us to be more irritable, reduced ability to handle things that we used to be able to handle before. So we have a low frustration tolerance because of stress. So these are the symptoms of stress. Can affect us in our bodies, can affect our thinking, and can affect our emotions. Bottom line is that stress has a holistic effect on the human body. It affects us physically, affects our emotions, which drive our behaviors. It also affects the way we think. There are consequences of stress. Consequences of stress might be to the individual, to the workplace, and to the family. So, to the individual, when we are under chronic stress, we are more susceptible to minor illnesses, like I've mentioned, even some cancers, talking about lung and colorectal cancer, increased medical conditions. So, yes, chronic stress does increase the risk of heart disease, increases the risk of coronary artery disease, that is the risk of the vessels that give blood to our heart, making them more narrowed and increasing the risk of heart attack. Stroke can increase the risk of stroke. Stress can increase the risk of stroke. Stress can increase the risk of obesity because the way some people cope with stress is by eating more. So this increases their body mass index. And obesity on its own, as we well know, can actually increase the risk of other cardiovascular problems, diseases of our heart, diseases of our blood vessels. Also, stress increases the risk of injury and mistakes. Now, in a workplace environment, if you're an employer, you want to make sure that the productivity of your staff is optimal every time. But when the staff is stressed and when people experience chronic stress, either from their families, from their workplace, then productivity itself reduces and illness is reduced as well. So we've come to the part where I talk about how to handle stress. What can we do? I've spent some time explaining what stress is. I've spent some time explaining how you would know you're stressed, from the physical to the psychological to your emotions. Now, this is the crux of this presentation, and this is where I explain to you what to do with stress. So there's several things you can do, but the number one thing where to start from is to start by identifying that you are indeed stressed, because you can be stressed and not know it. You can be feeling a lot of pressure and maybe attribute it to something else. Like people just say, well, this is how I react when things are difficult. This is just maybe a family thing. This is part of life. You may not even realize that you're actually stressed. So the first thing is to spend some time by yourself. I call it me time. 30 minutes at least, or less, depending on how busy your schedule is. The point is, spend some time in self reflection where you ask yourself, how was my day? What am I thinking? What's going on in my mind? And that the answer to that question, would let you know your thoughts, your perception. Maybe you have thoughts, oh, this is too much. I can't keep doing it. I'm tired. I'm exhausted. So this would be a telltale sign that you are actually stressed. And while you are reflecting on your day and looking over what has happened, this is the time to practice self forgiveness, self compassion. Perhaps there are mistakes you've made during the day and you handle things the way you felt like, I shouldn't have done it this way. There was a better way to do it. This time of self reflection is a time where you look back and you say to yourself, I'm a human being like everybody else. I make mistakes like everybody else. And just because I'm human, it means that the capability, the intrinsic ability to make mistakes is there. And so it's okay because I'm human and I'll learn from my mistakes and see how I can use this to increase the likelihood I don't make these mistakes in the future. And then you move on. So look for something you did right, give yourself credit for doing that right, and then use the experiences you've had to better your tomorrow rather than knocking yourself down, beating yourself up as though you are not human. So, having identified the source of stress, whether it's internal from you, the way you think, the way you behave, or external, the next step is if the stress is within your control or not. So, you've asked yourself, is this stress internal or external? Am I stressed at all, or is it both? The next step is to ask yourself, this stress I'm feeling, is there something I can do about it? Is it within my control directly or influence? Maybe I know someone who knows someone who can help me handle this. If the answer is yes, it's within my control, then you'd use something called problem solving, problem focused coping strategies, which we'll go into soon. If it is not within your control, for instance, maybe a sick child, maybe a difficult relationship, maybe a chronic illness that was just diagnosed, then the answer would be no. I didn't make myself ill. The doctor has said it is what it is. Maybe I have some terminal illness, God forbid, but it is not within my control. Then you'd use something called an emotion focused coping strategies. Finally, you could also look and see whether your perception is the reason why you're feeling stressed. Whether there is a way you look at it, the beliefs you might have about the situation. For instance, two people in a work environment, one person sees increased in the work that they have to do. They see it as, well, more work, it means more experience for me, and hopefully at the end of the day, a better pay package at the end of the day. People who see things that way are less stressed than people who, for instance, see it as more work, more stress. These people will not kill me kind of attitude. And then they feel more stressed as an outcome. So these are the first two steps. So if you determine that the source of the stress is not within your ability to control it, you can't control it, you can't influence it in any way, then that is where you'd use emotion-focused coping. So many things you can do. Number one, self-care. So when I talk about self-care, it's beyond taking care of your physical self. I think most of us have, to some extent, learned how to take care of our bodies. We'll go into that later. But beyond that, prioritize yourself, your emotions, your thoughts, and then self-soothe. So that's me time, the time you're spending by yourself reflecting on your day. How am I feeling? What's going on in my mind? This is a time you can use to soothe yourself. So the thing about us is we feel like we need other people to help soothe us. We need our best friends, we need our mom, we need our partners. The truth is that is great. And if you have it, that is fantastic. Social support is huge, but you can actually soothe yourself. So to self-soothe means to use your five senses in the service of helping yourself feel better and cope with whatever it is that is stressful to you. So let's start with the sense of sight. So what can you see or look at that would help you feel better? For some people, it's a picture of a loved one. Maybe if the person is nearby, you could go visit the person or do a video call. For some people, it's nature. For some people, it's a cartoon. For some people, it's a comedy. What can you use your sense of sight to look at that would reduce the intensity of whatever emotion that you're feeling? So you can use that to help yourself feel better. What about the sense of hearing? What could you hear that will make you feel better? For some people, it's calling a loved one. There's some people that will tell me that I know that if I call this person, they know just the right thing to say to me and I'll feel better. Or could it be maybe listening to some soothing music, listening to scriptural affirmations, listening to podcast, a motivational speaker? What could you, or how could your sense of hearing soothe you? What about the sense of touch? You know, we feel like we need someone to hold us sometimes. The truth is, you can actually hold yourself. So you can give yourself a warm hug. You could, you know, expose yourself to some sensations that are soothing. So talking about soaking yourself in the bathtub for people who like things like that, using scented perfumes, luxurious if that's within your means, um, moisturizers and things like that. So you can use your sense of touch to help yourself feel better. Lastly, I'll talk about the sense of taste. So I want us to be careful about this sense of taste because this is how people, unfortunately, inadvertently veer into emotional eating. But if you are disciplined and careful, the sense of taste helps a lot of people. Children, exactly, especially, oh, what do you want? Let's go for ice cream. And then they're smiling and they feel better. So for yourself, you can ask yourself, what will I taste that will help me feel better? So I've been talking about self-soothing, how you can use your five senses to help you feel better. Next, in terms of self-care is self-compassion. I mentioned self-forgiveness last time. So self-compassion is taking a bit further. Don't even wait until you've done something or made a mistake. You can actually give yourself credit for the things you've done right. Why would you look out just for when things go wrong and then you are your own worst self-critic and then you kick yourself when you're down? You can actually look for opportunities where you've done what you were expected to do, you fulfilled expectations, you've met up with responsibilities. You can give yourself a tap on the back and say, good job, you go. It was great I did that. Then, apart from giving yourself credit, you can also, if you have made a mistake, you can say, it's okay, I'm a human. How can I learn from that? How can I make this good? What can I do to make the best of this bad situation? So I've talked about give yourself credit. I've talked about realizing that you're human and you're fallible and you make mistakes and talking to yourself kindly the way you would a loved one, the way you would a dear friend. Not many of us will kick someone who's already down. Most of us will extend the hand of compassion, will encourage and say, you know what, learn from this. Life goes on. You are better for it. You're stronger for it. That is step two of self-compassion. Another thing you could do is ask yourself, what do I need? What do I want that will help me feel better? Then you can rope in the self-soothing in addition to you offering yourself compassion. Another tool you can use in your daily regular self-care that would help you to deal with stress is something called acceptance. So acceptance is not a get out of jail free card. Acceptance is not, giving yourself a pat on the wrist when you've done something wrong. Acceptance is realizing that a situation at hand is not what you want, but doing the best you can to achieve your goal in that situation. I like to use the analogy of perhaps playing poker. And there is 1 million naira or $1 million up for grabs. And then when the cards are dealt, you look at your cards and your cards are trash. And you say to yourself, I will not be able to win this with the kind of cards I have. Acceptance means realizing that this is not your preferred cards. This is not a situation you like. However, what is my goal in that situation? My goal is do all I can to make sure I get this 1 billion or $1 million or naira. So acceptance means accepting that the situation is not your preferred, but doing what you can to meet your goals in that situation. So in the case of the poker analogy, you will do your best to make sure that regardless of the cards you got, you play in such a way and act skillfully in such a way that you increase your chances of winning that money. Another analogy for acceptance is imagine this ball machine, like in tennis, where there's a machine that keeps pushing out balls. So and you're standing right in the fire of this machine. To accept means I don't like that this machine is shooting balls. I don't like to be shot with balls. So imagine that the balls are difficulties and problems. I don't like it. But to accept goes beyond I don't like it. It goes into I am going to get a bat or a racket and I'm going to do my best to shoot these balls and make sure they don't harm me. So that is acceptance. So I've been talking about regular self-care. Next is self-awareness versus avoidance. So these are things you do with your 30 minutes or so of self-reflection. To be aware means rather than to ignore, push away the negative emotions you feel or negative thoughts. To be aware means to face them head on and to look them in the face and say, yeah, I feel like a failure. I feel like I'm not good enough. Accept it. So the thing about acceptance is it gives you a true sense of the true picture. And if you run away from these negative emotions and negative thoughts, which is avoidance, they only just show up in other ways that are harmful to you. They show up in irritability. They show up in reduced stress tolerance, reduced frustration tolerance. They show up in you feeling the urge to use substances to help yourself feel better. So when you are self-aware, it reduces the chances that you'd use these substances. Plus, you are now able to problem solve and say, okay, this is what it is. What can I do to help myself feel better? Talking about self-soothing and self-compassion and acceptance. Next thing to do is express yourself. So beyond talking to someone and venting, you can actually validate yourself. So to validate yourself means to tell yourself that what I'm feeling and what I'm thinking makes sense given what I'm going through. And this is huge because when you don't self validate and maybe you self criticize, you add another layer of stress to yourself and you compound situations. So instead of being your own cheerleader, you are now your own self critic and make things worse. So rather than waiting for someone to validate you and tell you, oh, I hear you, this is terrible, you can do that for yourself. Other ways to express yourself, to disclose to someone that you trust, to journal. So the thing about expressing yourself, either in writing or in music or in painting or in sculpture, is that you give creativity to the feelings you have rather than keeping them inside. So I want to point out one thing. Venting without validation does not actually reduce the intensity of the emotion you feel. Just to point that out, because some people feel like I have to say it. I'm so intensely emotional. I can't keep quiet. And then you pour it on someone, you project your negative emotions and your negative state on someone who is under your authority, maybe your kid, maybe your partner, maybe your friend. So that's not what I'm talking about. I'm talking about turning this negative emotion into something creative through journaling, painting, sculpting, music if you're a musician, and self-validating. Spirituality is huge. So this is how you can deal with stress that is beyond your control. And it can actually be added to problem-solving coping techniques, which we'll go into in a bit. So evidence has shown that people who trust in a higher being, God for most of us, Allah for some of us, are actually more able to handle stress than those who don't. So we have an improved or increased sense of wellness, increased motivation, increased wellness when we are spiritual versus when we are not. And also because we have a sense that we are not alone when you have a God that you can pray to and hand all your problems to. So, in terms of self soothing, you can listen to scriptural affirmations that will definitely help to reduce the intensity of stress you feel. Other emotion focused coping strategies, deep breathing. So, these are all things I do and I recommend to my patients. So, deep breathing, different types, but the one I prefer is something called the 478 technique. So the four stands for take a deep breath while counting to four in your mind, hold it while you're counting to seven, and exhale while you're counting to eight. So what this does is that it induces the um, relaxation, it induces relaxation and it quickly makes us go from tensed and hyper and stressed to relaxed and calm. And you can do it more than once. So you take a deep breath while counting to four in your mind, you hold it while counting to seven, and then you exhale while counting to eight in your mind. Deep breathing 478 technique can go with other coping strategies. So it doesn't have to be one or the other. You can combine these things depending on what you want. Visualization is very powerful for people who tend to think or have mental pictures in their mind. There are people who think in pictures. So if this is you, visualization would really help to reduce the stress you feel. So visualization means to picture yourself, create a mental picture of yourself coping with that stressful situation and actually overcoming it. So you paint the scenario in your mind's eye of the stressful situation. And then you also go ahead to picture and imagine yourself handling this skillfully using maybe self-soothing if it's an emotional or if it's a stress that is beyond your ability to control or doing problem solving. The bottom line is that you're picturing this. So this is something I do. I remember writing a final exam in medical school, and months before the exam, I saw myself vividly in the exam hall feeling stressed initially, maybe sweating a little bit. And then I imagine myself, calming myself down, writing the exam. We have things called Viva in medical school where you have an interview with the professors and they're asking you questions. And I imagine myself answering, being calm, and then going into the exam and, doing well at the end of the day. So this really helped because before you come into the stressful situation, it's as though you've been there 1,000 times in your mind. So it's almost as if you've inoculated yourself to stress. Another helpful emotion focused coping strategy is mindfulness. This is huge in so many ways. If you're dealing with worry, you tend to go into the future. And because you're into the future, trying to prevent what could happen from happening that has not already happened, you are not in the present. And because you're not in the present, you're forgetful, you're absent minded, you are easily annoyed, easily irritable. So being in the present makes you more aware of what's going on and prevents you from compounding the situation by being absent minded and forgetful. So, how do you do this? So, it's to focus your attention on what is before you, whatever it is that you are doing in the moment. So, when you're being mindful, it is true that your mind will wander. Your mind will drift back to the thing that is bothering you, either in your future or in your past. But the trick is not to blame yourself for this mind wandering, rather to validate yourself and saying, it's okay, I'm human, my mind will wander, and gently without criticizing yourself or, struggling with yourself. Just bring your mind back from where it has wandered to the present. The more times you do this, the more likely you are to put your attention on what is happening in the present. And this would reduce the intensity of anxiety. Maybe you're worrying about something in the future, or even sadness, depending on what it is. Maybe you're ruminating about something that has gone wrong in the past. So to be mindful means live in the moment. So you can either just imagine or try focusing your 100% attention, your sense of sight, your hearing, and everything on the moment, or you can do it sense by sense. So you can do it, first of all, what can I see? So you would start by describing what you're seeing, for instance, or what you're hearing to yourself. So you notice, you describe, and then you participate fully in noticing, describing, whether it is what you see or what you hear. And then you try to make sure that you are not drifting apart. And if you do drift, it's okay. Just bring your mind gently back. So the what of mindfulness is notice what is in your environment, describe to yourself what you've noticed, and fully participate. The how is not to judge yourself when your mind derails, and to do this noticing effectively. Realize your goal for that situation. For instance, I'm trying to give a presentation, but I'm hearing voices in the background. So my goal is to give as lucid a presentation as possible without being distracted by things in the background. So the what and the how, that is mindfulness. Next thing you can do about helping yourself, handle situations that are stressful, that are not within your control, is to distract yourself. But this is only temporary, because you cannot live a distracted life. If you continue to use only distraction, it will go into you avoiding and not being aware, which will compound things. Another thing you can do to handle things beyond your control is to practice being assertive. So assertiveness is a huge type of communication skill that we can all practice and learn, which is huge because it is you standing up for yourself, speaking your mind in a way that does not infringe on the rights of the person you're talking to. So to be assertive means to stand up for yourself and be respectful of the rights of the person that you're talking to, versus being aggressive, where you are standing up for yourself, but then you are being demeaning or condescending to the other person. And also different from being passive, where you are not standing up for yourself and you're like a doormat, and then people are demeaning and condescending towards you. So to be assertive means to, stand up for yourself and be respectful at the same time. I'm going to point out some unhelpful coping strategies just so that I draw attention to it. That there are things that seem to help in the interim, but actually in the long term, they complicate things and make our stress more. Using substances can be as simple as drinking alcohol. Oh, I need to get some sleep. I'll take a shot to help me. Eating more or eating less. Infidelity, I mentioned it earlier, where we tend to develop emotional bonds with people that, in the interim, in the meantime, it's comforting, it's nice, it's affirming, but in the long term, it ruins our primary relationship and our marriages, for example. Avoidance is another unhelpful coping strategy. In the short term, it helps. I'm avoiding. At least I feel less stressed. I feel less angry, less anxious. But in the long term, it shows up in the way I talk to people, in my ability to handle frustration. Rumination and brooding means going over and over in your mind what has already happened in the past, and then you keep blaming yourself. So the disadvantage of that is it can inch you closer to depression. Catastrophizing is another unhelpful coping strategy. To catastrophize means to think the worst. So people who do this, they do it because they think it's helpful. Let me think the worst so I can prepare for it. And if I prepare for it, then I'll be ready. But the downside of catastrophizing is that it increases anxiety, especially when there's nothing you can do about it anyway, because you cannot go into the future to know what will happen, let alone prepare for it. So what happens when we catastrophize is that we increase our anxiety in the moment, reduce our innate abilities, and unfortunately increase the chances that what we fear will happen actually does happen. Non-disclosure is another unhelpful coping strategy. I can't talk about it to anyone. I don't want to do anything about it. You keep it to yourself. So what happens is that it shows up in other ways. Problem-oriented coping strategies. I've been talking about coping strategies, emotion-oriented coping strategies. Now, this is what you can do when the problem or the stressor is within your ability to control it or handle it or influence. So you can actually do something. All the things we've been talking about before are when you can do nothing about it. So you can go ahead and problem solve. For instance, I feel stressed at my job because I don't have the things I'm asked to do are beyond my job description. I can have a conversation with my boss. I can talk to my line manager. There's something I can do about it. I don't have to sit and be stressed and it will affect my productivity in the long run. Sometimes time management is really all we need. Sometimes if we were able to prioritize and say, this is a matter of urgency, this is something useful, this is urgent versus this that can wait, and that would really reduce the intensity of stress we feel. Sometimes the stress we feel is really as a result of procrastination, which in itself is another topic, by the way, but let's not derail talking about time management. So I'm saying that there are things we can do for stressors that are within our ability to control or handle. For instance, you're a busy mom, you have little kids, and then you have a job, maybe you're a manager. You can get instrumental support. You can get someone to help. You can delegate at work, things like that. Or you can get professional help, for instance. So beyond emotional and problem-solving coping strategies, another way we can handle stress is to check our perception. In the very definition of stress, stress is perceived imbalance between our expectations and demands placed on us and our ability to meet these expectations. So it's all about perception. So we can look at our perception. We can look at our thoughts. There's something called the cognitive model. The cognitive model is a way of seeing things, a way of understanding that was created by the late Professor Aaron Beck, who is actually the founder of cognitive behavioral therapy, which I practice. So this basically means that it is not the situation that we experience that causes us to feel emotional or causes us to do what we do as a result of our emotions. It is the interpretation we give to these situations. So it is not the situation. For instance, maybe husband forgets my birthday or your birthday, and then this is a situation, right? So my thought could be, he doesn't love me. And then I feel very upset, I feel sad, and then I don't cook dinner or I begin to act out or things like that. So you see, it is not necessarily what was done in forgetting the birthday. It is my interpretation of it. So if I look at my interpretation, if I question my thoughts rather than accepting it hook, line, and sinker because it came from me, then perhaps I will see things differently and my emotion will change and my behavior will change. So there's an acronym called FAST, FAST, that can guide you into how exactly to question your thoughts. So in the example I gave where I said, forgot my birthday, doesn't love me, using the F, which means F stands for facts. What is the evidence? Check the facts. What is the evidence in favor? What is the evidence against? So what is the evidence that he forgot my birthday equals he doesn't love me? The evidence is that, well, he should, in favor means he should not forget my birthday. How can he say he loves me and he doesn't remember my birthday? Evidence against might be he has never forgotten my birthday until now. And I know that he's been stressed up lately at work. And he does everything a good husband should do. He pays the school fees. I even have pocket money. I have his ATM card and things like that. So when you look at the evidence in favor of your thought and the evidence against your thought, you'll be able to come up with an alternative way to look at it. And that is how your perception changes. So I've talked about the F, the A, alternative way to look at it. The S stands for so what if it's true? So what if it's true that he doesn't love me? What's the worst that could happen? The worst that could happen is maybe it will affect my relationship. So what could I do about that? I could have a conversation with him, drawing in problem-solving techniques. I could ask him, baby, what happened? You forgot my birthday or whatever. And then we can have a conversation and he'll be like, oh my goodness, it's not like that. How could you think that? And all that. So that's the S. Then the T means the tall. What this means is, what is the consequence of thinking this way? What do I stand to gain by thinking that his forgetting my birthday means he doesn't love me? Is that a good way to think, or is there a better way to look at it? So I've talked about FAST, fast, which is a way to check your perception of particular situations to know whether they are facts or they're actually opinions and negatively skewed ones at that. There are so many other ways to handle stress beyond what I've said already. And these are to achieve a healthy work-life balance. We talk a lot about balance your life, balance your work. I'll go into that in a bit. Maintaining a healthy lifestyle is huge because we all tend to sometimes believe that physical health is a bit more important than mental health, which encompasses our thoughts, our emotions, and the way we treat other people or even ourselves. But that is a fallacy, completely false. The truth is that our mental well being is just as important as our physical well being. And in addition to that, our physical well being can affect our mental well being and vice versa. So if you want to make sure your mental well-being is optimal, then you need to take care of your physical health. Earlier on, I talked about the relationship between stress, our bodies, our minds, our ability to concentrate, things we think, and our emotions. So it's really all intertwined. Human beings are not just body. We are definitely more than that. We are emotion, we are thought, we are will, and all that. Then finally, I'll talk a bit more about communication. I mentioned earlier about assertive communication. I'll go into details in the coming slides of the steps to go into this assertive communication. So, achieve a healthy work-life balance. This basically means to balance your life and your work. A lot of people, unfortunately, their work is their life. And so you can imagine that when there's toxicity at work, there is actually toxicity in the entire life. So to balance this and to actually increase or flesh out or increase the values and the goals that we have for other aspects of our life can actually maintain this balance. So you have to start with setting boundaries. So for instance, you need to realize that work is work and family or other things that matter to you, spirituality, friends and family, fun and adventure, volunteering or sports, these other aspects of your life are equally important. So to set boundaries means to realize, first of all, within yourself that they're not the same. And for me to be able to give myself optimally to all these aspects of my life, I need to have, a boundary. I need to keep work at work and home at home. There's something called compartmentalization, which I love. If you were to ask me, one of my top favorite stress management techniques, compartmentalization would be up there. To compartmentalize is just that, to separate the different aspects of your life so that when there's toxicity in one aspect, it doesn't naturally diffuse into every other aspect. So just the way you would use scaffolding or whatever demarcation to demarcate maybe a big room, imagining if that big room were representative of your life. That is what I mean by compartmentalizing. And you start by first identifying your values, your other values, things that matter to you. So it could be, like I mentioned, spirituality, it could be friends and family, it could be fun and adventure. So if, excuse me, I've lost presentation. Okay. So if, for instance, spirituality is important to you, it's a value of yours, you'd want to ask yourself, what are my goals in this area? What do I want to be able to achieve in my spiritual life? Or maybe fun adventure is important to you. What do I want to be able to achieve in this aspect? Maybe I want to experience some kind of fun in my life, either daily or weekly or monthly. So you'd have a goal, and then you plan on everything you could do, the behaviors you could put in place to achieve these goals. So this is what I mean by compartmentalization. So when you build up these other areas of your life, whatever toxicity is happening in any other area, not only work, maybe your relationship, for example, maybe with your children or whatever it is, you are better able to handle it because you have some other source of positive emotions that help you balance it out. Maintaining a healthy lifestyle involves exercise, diet, sleep, water intake, avoiding substances. So I'm going to give general guidelines. So I hope that this would be a call to action for you to first of all start to not only engage in physical activity, but to be sure to have a, you know, check in with your doctor, with your primary healthcare provider, so that they can give you the all clear. But if you have no medical condition, you have, hypertensive, you're not diabetic, and maybe you're not even obese, what is recommended by research is at least 30 minutes of some kind of aerobic physical activity. So aerobic physical activity means whatever activity you engage in that makes your heart beat fast. So it could be jogging, it could be walking, it could be playing a game, it could be whatever it is. It makes your heart beat fast, and you're engaging it for at least 30 minutes. So it doesn't have to be 30 minutes at a stretch. So it could be 15 minutes one time, another 15 minutes some other time, 10 minutes, 10 minutes, 10 minutes. The bottom line is that in 24 hours, you would have engaged in 30 minutes of physical aerobic activity. Now, this is if you don't have a medical condition or you're not obese. If weight loss is your goal, then you need to up this to about an hour. But do remember to get the all clear from your primary health provider before you go into any kind of physical activity, because you might have some underlying medical condition that would, worsen or would contradict, you're doing these things. Diet. So you can see the picture that I have on the slide. Vegetables and fruits, about half of your plate. The remaining half would be carbohydrates and protein. So carbohydrates, complex, preferable, better than simple. Complex carbohydrates are things like fibers, like quinoa, lentil, brown rice, brown bread, brown spaghetti, if you can find it, beans, for example. These are all complex carbohydrates. And the reason why they are preferred is that they release glucose into our bloodstream in a steady stream. So for people, for instance, who have diabetes, complex carbohydrates, you might be familiar with that. Doctor would say beans or fada rice, local rice versus refined things. And then the protein, the white meat is better than the red meat. Why? Because cholesterol is higher in the red meat. Plant-based preferable to animal-based proteins. Adequate sleep is huge. Everything is worsened when you don't sleep well. The likelihood of mental illness is increased by poor sleep, especially if you already have a predisposition genetically. So on average, we should all strive for anything more than at least 4 or 5 hours a night. If you can make it 7, that would be fantastic. So if sleeping is an issue, it's something really worthy of a visit to your healthcare practitioner, because it could worsen everything else and it could actually increase your risk of cardiovascular problems. Water intake is good, about 3 liters every day, and avoid substances. Then other ways to handle stress is something called an acronym ABC. So I've mentioned so many things we can do to handle stress. I hope that as I'm talking, you are taking notes and really internalizing so that you can have your own stress management kit. Not everything will work for everyone. The important thing is to, glean out things that work for you and try and practice it. So the A stands for accumulate positive emotions. So this basically means see whether in the short term or in the middle term or long term, you can continue to engage in behaviors that would increase positive emotions in your life. So it could be something as simple as watch home videos if that makes you happy, or call your mom or your whoever, your best friend. Schedule activities that increase positive emotions. The way we schedule appointments, schedule business, we should also schedule things that increase pleasure and even increase our sense of achievement. Things that in the short term, the middle term, the long term would help us to give, to increase our positive emotions. The B stands for building a sense of mastery. So this means that there are difficult things in our lives, things that we need to do, give us a sense of achievement, but it's hard, it's difficult. So little by little, by breaking it up into smaller parts, we can schedule in our lives times where we handle these difficult things. So it could be something like, okay, I want to do a master's. A master's in whatever would give me a sense of achievement. And then I look at my schedule, I'm very busy, so I could like break it up and say, okay, on Monday I'll at least look for the schools. on Friday next week, I could at least find, look for a time in my schedule where I could make this work and things like that. But just build time in your schedule or create time in your schedule where you put or engage, bring out time to engage in behaviors that will increase positive emotions and that sense of mastery. So the good thing about this is that doing these things increases self-efficacy, the sense that you can achieve things, the sense that you are able and capable. And this is what reduces our vulnerability to stress. So doing this is what separates people who feel stress in a stressful situation versus those who don't really feel that stress. To cope ahead, Cope ahead is another very helpful skill to have to help you to reduce your vulnerability to stress. So, cope ahead is similar to visualization that I mentioned earlier, but it is beyond actually just imagining it in your mind's eye. To cope ahead means to actually picture a difficult situation, picture all that could go wrong in the situation, and plan out concrete things you can do to prevent this from happening. And if you can't prevent it from happening, to do damage control before it even happens. So, and then in addition, you can also visualize. So the A, the B, and the C are things you can do to reduce vulnerability to stress. In other words, reduce the tendency that you'll be stressed even before the stress shows up. Then communicate. We mentioned assertive communication. How do you talk assertively without it coming off as being rude or demeaning or condescending? So there's an acronym called IDEA. I stands for icebreaker. It means state the emotion you see and empathize with it. And if you need to apologize, this is the time to apologize. So icebreaker means what you say that will acknowledge to the other person that I hear you, I understand, and maybe I'm sorry if you are. D stands for describe the situation. E means express how you feel using words I, not you. Express how what happens makes you feel. So this is particularly difficult for some people where when I say express, they're talking about what they would do to handle the problem, not how they really feel. So if you feel disappointed, say it. If you feel angered or sad, say it. Assert is where you say specifically what you want or what you hope would happen. So this is a note to employers to reduce toxicity in the workplace environment. You have to be careful about the job designs, make sure that the roles are fit the employees, flexible work arrangements, employee recognition, offer wellness programs like this, ensure clear communication between company goals, expectations, basically try to foster a supportive and positive work environment. So in conclusion, I've been talking about stress. So stress is universal. Everyone experiences stress, including children. And stress could be acute or it could be long-term or chronic. So it can affect every aspect of our bodies, of ourselves, our bodies, our minds, our emotions. Using the techniques I've talked about would really help everyone handle stress, even increasing vulnerability, reduce vulnerability to stress, and ensure physical, emotional, and mental well-being. Thank you so much for listening.